Hello, and welcome to Timing is Everything. This program is put on by Care Dimensions, formerly Hospice of the North Shore in Greater Boston. The programs that we will be doing will cover a variety of topics, all geared towards helping individuals and families to have a greater understanding of resources and to have a greater sense of control when faced with an advanced illness. Timing is critical. Advanced knowledge and planning ensures that individuals and families' wishes are understood so that people can live their lives to the fullest. Care Dimensions was founded in 1978 as Hospice of the North Shore. The name was changed in 2014 to encompass what we have become: compassionate expertise for advanced illness, including hospice, palliative care, and support services. Care Dimensions is a not-for-profit and is the largest hospice in the state of Massachusetts. Care Dimensions covers over 90 communities. The main office is right here in Danvers, and we also have another office in Wellesley. My name is Mary Crowe, and I am the Education Coordinator at Care Dimensions. I have had the privilege of working for Care Dimensions for nearly the past 10 years. My role at Care Dimensions is to provide education to professionals and to community members. Care Dimensions offers extensive training to both professionals and community members. Last year, we provided over 400 programs to over 5,600 people. I have been a medical social worker for the past 30 years, focusing on caring for individuals and families with advanced illness or at end of life. I have a postgraduate certificate in gerontology, alcohol counseling, and dementia. This episode, we'll be talking with Dr. Stephanie Patel, the Chief Medical Officer of Care Dimensions. Dr. Patel will discuss the specific services that are provided by Care Dimensions, as well as myths and misconceptions around hospice care. Dr. Patel will also speak to the differences between hospice and palliative care, as well as support services that are available. We're going to take a brief commercial break and then get back to our show.
Care Dimensions, formerly Hospice of the North Shore in Greater Boston, is different in that we do more than just hospice.
It's just incredible, the services they provide when people need it the most.
So being able to offer more individualized care helps people feel more cared for.
Because it's about the patient's quality of life.
I don't think there's any place else in the Boston area like Care Dimensions.
At Care Dimensions, we'll take care of your family like you're a part of ours. Visit us at caredimensions.org.
Welcome back to our program, Timing is Everything. It is my pleasure to introduce to you our guest, Dr. Stephanie Patel. She is the Chief Medical Officer at Care Dimensions. Dr. Patel is board certified in family medicine and hospice and palliative medicine, and has been with Care Dimensions since 2006. Dr. Patel received her medical degree from Temple University of Medicine and completed her undergraduate education at the University of California at Santa Barbara. Welcome, Dr. Patel.
It's great to be here, Mary.
Thank you. I'm so excited that you're here today because, hospice and palliative care is so misunderstood. So this gives our audience a chance to better understand that. So before we start into that, though, tell me what brought you to hospice work?
Well, as a practicing family physician, I felt at a loss to help patients that were dealing with life-limiting illnesses and choices because it's not something we received a lot of training in when I did my medical school and residency training. So I started thinking that patients were receiving treatments that maybe they didn't understand or didn't really want, and started looking into this area and discovered that I could take some extra training, and so I left my practice and did a year fellowship in hospice and palliative care and have been practicing for about 10 years now.
That's great. Well, tell us what hospice care is.
So hospice care is really compassionate care for those individuals that are suffering a life-limiting illness. The uniqueness of hospice, though, is that it's not just for the patient, but really looks at the whole patient and family as a big unit. And that's one of the reasons I went into medicine, so I find it such a unique area to practice in. And we really deal with not just the physical needs of the patient that most medicine deals with, but also with the spiritual, psychosocial needs as well.
Excellent. Yeah, there's so much focus sometimes on that person that we sometimes forget that the family is extremely impacted by people with that loved ones with advanced illness and also at end of life.
They are, especially caregivers, and hospice and the hospice team really also focuses on helping the caregivers take that journey while their loved one is very critically ill and then going into the dying phase.
So you said hospice team. Tell me, who's on that hospice team?
Well, the hospice team really comprises a lot of individuals, a lot of people. First and foremost is the patient and the family, but then also the patient's physician, as well as the hospice medical director, a nurse, a social worker, a chaplain, volunteers, and they can also receive a hospice aide, as well as participate in complementary therapies. So their team could include massage therapist, music therapist, art therapist, pet therapy. So it's a very large team, again, looking holistically at the whole patient and all of their suffering.
Yeah, you know, when you talk about these complementary therapies, and I want to just go to that for a second because, you know, we're going to talk about misconceptions in a minute, but, you know, these complementary therapies, this is something unique, isn't it?
Yes, complementary therapies is unique to Care Dimensions, and it really looks at an alternative way to help people with pain and symptoms, anxiety, stress, just a lot of different types of suffering that patients are undergoing as they're dealing with their life-limiting illness.
You know, and that's a good point. You bring up suffering because, again, a lot of times when people think of suffering, they think of, or pain, they're thinking of that physical pain. But I think that's something that's so really enlightening about hospice care is that pain isn't just about the physical pain, is it?
No, pain is about emotional pain, spiritual pain. And again, hospice looks at the caregiver's distress as well as the patient is going through this journey.
Yeah.
And our goal is really to improve the quality of life for the patient and the caregiver so they can enjoy all the time that they have left.
Yeah. You know, and again, good point, because again, I think a lot of times when people hear that word hospice, sometimes again, there's that focus on are people are really dying at that point. And I think there's such a misunderstanding about that. Really, truly, when we're looking at hospice, it's about living.
Correct. Hospice really, it is a misnomer that hospice and dying are one and the same thing. My goal really, again, is to allow people to live the best that they can for the time that they have left.
Yeah. Yeah, you know, and again, you're talking about that, it makes total sense now when you talk about that team approach because you're talking about that spirit, mind, and body. And it's wonderful that Care Dimensions does offer those complementary therapies because obviously they have a tremendous impact on people.
They do. It's amazing how much massage therapy and music therapy can really improve someone's quality of life, regardless of what disease process is going on.
Excellent. So tell me a little bit, where can hospice be provided?
So hospice really can be provided anywhere that the patient lives. We go wherever the patient calls home. So that might be a patient's physical home, their apartment. It could be the daughter's home. It could be an assisted living facility, a long-term care facility. Wherever they really call home, that's where we go.
Yeah. You know, and again, a lot of times people are thinking hospice is about a place.
That is one of the classic misnomers that I hear all the time, that, oh, I'm going to go to hospice. Hospice is actually a service that's provided similar to home health aid or physical therapy. It's actually a service that your insurance pays for that in this case covers that whole team approach that we talked about. But there are facilities called hospice houses that also do exist. So I think there is a little bit of confusion there often, that people think hospice is just in relation to those actual buildings.
So you said hospice house. So again, you know, obviously Care Dimensions does have a hospice house.
Yes, Care Dimensions has one of the first licensed inpatient hospice facilities in the state called the Kaplan Family Hospice House, which is an amazing facility that allows people, it's a home-like setting, and it allows caregivers to just be family and helps those who are really having a difficult time towards the end of life, keeps people out of the hospital which is really critical at this stage because most people don't want to spend their last 2 weeks, their last 3 months, whatever, in the hospital or going back and forth, spending time in the emergency room or in the hospital. They'd rather be at home and with their loved ones.
You know, and the Kaplan Family Hospice House is amazing. And, you know, our next show that we're going to be doing is going to talk just about the Kaplan Family Hospice House, and we're going to go into details about that and also be able to give people a tour of the house. And I think that that will be very powerful for people.
I think so as well. It, again, is a very unique setting, and those on the North Shore are very lucky to have this type of facility available to them.
So tell us again, we've touched a bit on this already, the misconceptions about hospice, the myths and misconception, there are a number of them. So let's talk a little bit about that. So all hospices are alike. I hear this one out there all the time. Tell me what you're thinking of that.
All hospices are not alike. One hospice is one hospice. There are numerous differences between individual programs. For example, some hospices are not-for-profit, some hospices are profit. Care Dementias is a not-for-profit. We are also a freestanding individual hospice. Some are associated with VNAs, some are associated with healthcare systems, some are associated with nursing facilities. So those differences, some programs have the ability to have individual programs like our complementary therapies, while others do not have programs like that. There are, I could go on and on about the differences between hospices. So when you are talking about hospice, you really have to know your individual hospice and what they can provide.
Absolutely. And again, a key point to what you're saying too is, because I've heard people say, geez, I asked for hospice and where were you? And not understanding that, you know, the person has to ask specifically for a hospice by name. They need to say, you know, I prefer to have care dimensions, or, you know, that sort of thing, because again, it doesn't guarantee when you say the word hospice that you're going to get the hospice of choice.
Correct.
So another myth and misconception is about what is the primary diagnosis that you often think of with hospice care? Cancer. So tell us about that.
So what I'm always explaining to community physicians is that when hospice first started, it really did focus on cancer. And about 45% of our patients last year were cancer patients, but the remaining had a whole host of different diagnoses. So I really encourage people to look outside the fact that hospice is just not for cancer. So other diagnoses like end-stage cardiac disease, end-stage emphysema, Alzheimer's dementia, other dementias, Parkinson's disease, ALS, all those kinds of diagnoses, anything that is a life-limiting illness really could qualify a patient for hospice.
Which leads us to, again, you know, you're talking about the various diagnoses or medical issues that a person can have that could bring them on to hospice care. So tell me about Care Dimensions has disease-specific programs. Again, another unique thing, right?
Correct. Not all programs treat individual diseases any differently. Everybody sort of gets the same type of treatment. Care Dimensions learned that individual disease processes require individual plans of care and different type of care. So we have a disease-specific program for those patients with end-stage cardiac disease, as well as one for end-stage respiratory disease, and another one for dementia. And each of these is really individualized towards what issues are these individuals dealing with as their disease progresses, because they're all different.
Which is great, because again, as you say, not all diseases are alike. There are specific, unique needs, and certainly those programs are certainly wonderful and helpful. So in terms of other disease processes or other myths and misconceptions?
There are, a big misconception is that patients have to fill out a do not resuscitate order in order to be on hospice. And this is actually another common misnomer, which is, it is not true. You can choose to have resuscitation and be on hospice. Okay. That's another common misnomer that I find. I also explain to families and patients that, again, hospice is a service. It's not something that we move in with you.
Right.
And because people are actually afraid of that. Lots of people don't want all of these people in their homes. And we come in and out as, team members individually. It's not all, 6 or 8 of us coming in at once either. So it really allows patients and families to feel a little bit better that we're not going to all bombard them.
Right. Yeah. I think people do worry about that, and and certainly, that sometimes that team, and like you say, people can come in at various times and it's not going to be overwhelming, but also it's not about moving in, so that's important. These myths and misconceptions are really important, and I want to touch on some more of these. We're going to take a break in a couple of seconds, and we're going to come back. We're going to talk more about those myths and misconceptions. We're also going to talk about palliative care.
I have worked in a lot of different settings, and I have never seen the care, love, and support that I've experienced with Care Dimensions.
Because it's about the patient's quality of life.
We provide care during one of the most challenging times in a family's life.
One of the things that we really focus on is how people want to live their life.
We have transformed the way our community experiences end-of-life care. It is more than hospice. It is care for advanced illness.
At Care Dimensions, we'll take care of your family like you're a part of ours.
Welcome back to our program, Timing is Everything, a program of Care Dimensions. We're talking today to Dr. Stephanie Patel, who is the Chief Medical Officer at Care Dimensions. We're talking today about hospice and palliative care. We've been talking about facts associated with hospice and some of those myths and misconceptions that are out there. So before we go back on and we're going to talk about palliative care in a minute, but what I want to talk about right now is we kind of left these myths and misconceptions hanging, and I just want to go back to so what other myths and misconceptions do you think that people have?
I think people think that when they choose hospice, they choose to stop getting all kinds of treatment, that we are just going to stop caring for them medically, and that is not true. As we talked about, my goal is to have individuals live the best and the longest that they can with the best quality of life. And so we continue their medications, and provide all of the services that they would still get whether they were on hospice or not.
Yeah.
That people also are concerned that they will lose all their medical care, for example, their physician. And this is a misconception. Your physician stays involved the entire time that you are on hospice and remains your physician, and you can still go into the office and see your physician, just as if you had some type of an emergency and needed to go to the hospital, that you would still get that type of service.
So that's important for people to know, because I think they do worry sometimes about, do I have to give up my physician?
They do. It's a really common misunderstanding. It's a question I get all the time. The other one I think that I get a lot from patients and families is once they choose this, they can never go back and they'll lose their Medicare benefit. And I like to reassure patients that that absolutely is not true. That if you choose to come off of hospice, you can do that, and your Medicare just gets reestablished very instantaneously.
Excellent. And I'm going to ask you that question in a second, just around coverage and all, but I just want to just touch base for a second about, again, when people think of hospice care, they're thinking that it's just for those final days or hours, and I just want to help clarify that again. So
Yes.
How long can somebody be on hospice care?
Well, hospice, the benefit through Medicare was actually designed for patients for 6 months. So when people think it's just for those people that have a few days or a few hours, that's definitely a misnomer. You're supposed to have at least 6 months on hospice. There is not a cut and dry window for a timing of hospice. So you get 2 90-day benefits that total that 6 month, but after that you get an unlimited number of 60-day benefits. So there is not an actual cutoff for how long you can be on hospice. As long as you remain eligible, which is determined by the physicians, then you can continue your hospice benefit.
Okay. And some people worry. They worry about cost.
Yes.
So tell us, how is hospice paid for?
So hospice is a covered benefit, 100% covered benefit under Medicare. It's one of the only 100% covered benefits, so the patients do not pay anything for their Medicare hospice benefit. Other commercial insurances also have hospice coverage that is very similar, though Medicare has the most robust benefit. But many of the commercial insurances and private insurances have mimicked that, as has Mass Health. So any insurance company that practices in Massachusetts has to offer some type of hospice benefit.
Okay, so you said earlier that hospice covers the team visits.
Correct.
What else is covered under the hospice benefit?
So individuals under hospice also get their medications that are related to their life-limiting illness covered. Any medications that are helping to treat symptoms, those are all covered by their hospice benefit. So they would no longer be paying for those out of pocket. They also get coverage for any type of medical equipment they would need. So if they need a hospital bed or a wheelchair or a walker, those things are all covered. Oxygen is covered. In addition to complementary therapies, if they are getting that, and any of the team members that they get.
Excellent. And how about, like, do they have to meet certain criteria around, like with oxygen, things like that? Because I know that, some patients have to meet criteria under other benefits. But with hospice, oxygen they get, because it's considered something for comfort, right?
Correct. So there is no criteria as there are in other situations for oxygen. It is just if the team feels that the patient would benefit from oxygen, then they would get oxygen.
The other question that comes up too is about, how about homebound status, right? Do people have to be homebound in order to receive hospice care?
Again, we're looking at having people have a good quality of life for as long as they can, so you don't have to be homebound to be on hospice, which is the wonderful thing about hospice. So you can still enjoy going to dinner with your family, or going to get your hair done, or things like that, and still be eligible for hospice.
Excellent. So now let's clear up the confusion sometimes that people face around palliative care. So tell us, what is palliative care? And then we'll go into, again, how it differs from hospice care.
So palliative care is sort of a newer term that's come up, and people do get very confused about, am I getting palliative care or hospice? It, again, is that same focus on improving quality of life for those individuals with life-limiting illness. It looks at the whole person, just as hospice does, but there is no restriction to the time limit. So palliative care is for anybody from the time of diagnosis of a life-limiting illness all the way until they choose hospice. So it could be that you're diagnosed with cancer, or you're diagnosed with end-stage heart failure, and you get palliative care at the very beginning until you become eligible for hospice, and then you transition to hospice.
Okay, so it can be a transition point. Can people receive palliative care without going on to hospice services?
Absolutely. Palliative care, again, it's just taking that hospice focus of quality of life, symptom management, looking at emotional and spiritual suffering upstream while people are going through their disease process. Okay. I think it helps patients and families as they go through those transition processes while their disease gets worse. It helps people understand. But they receive palliative care while they're receiving any kind of treatment that is trying to prolong their life or treat their disease, their medical disease actively.
So curative treatments.
Correct.
Yeah, and again, so that's one of the distinctions sometimes that we can see from hospice care, because again, I think people get very confused, because when we look at hospice care, and it's about care and comfort and pain and symptom management, and then we look at palliative care, so sometimes people get confused thinking, what is palliative care, because it's the same thing. So, but there are distinct differences too.
There are.
So try, if you again, talk more about kind of more of the distinct differences that there are between palliative and hospice care.
Well, palliative care also too is its own medical specialty, just like cardiology or nephrology is. So it is usually a physician or nurse practitioner that what their focus is helping with the whole process that the patient is going through, and that includes the emotional and spiritual side of that. It does not necessarily include the team that you get with hospice, so it's not always the team of the nurse and the social worker, though there are components of that as well that you will get with palliative care.
Okay. So in terms of Care Dimensions palliative care program, that's pretty unique.
Yes, it is. Again, it's really run by physicians and nurse practitioners that, again, at Care Dimensions, go out to the homes to see patients, and that could mean their home or a nursing home or a nursing facility. We also have an outpatient office that patients can come into, as well as seeing patients that are in the hospital acutely ill.
Okay, great. So, you know, that's great. And again, you know, this is very important information that you're providing to us. What other things can you think about in terms of that we haven't discussed that would be important for our audience to know about hospice or palliative care?
I think one of the things is that people always, again, as we talked about, think hospice is for the very end, but I think that patients and families really do get more benefit the earlier they come on hospice. And over the 10 years I've been doing this, most people say, oh, I wish that I had hospice earlier. I never really hear, you know, oh, I didn't need hospice, you know, that it was really something that they didn't know that much about, but they are so grateful for and don't realize all of the interventions that we can help them do that will help them feel better and live, you know, a full productive life for as long as they can.
Excellent.
As far as palliative care, I think that not enough people really know that it's out there and it's offered. I really do think that it's important to receive palliative care when you've been diagnosed for that life-limiting illness, just so that you understand what your future looks like, and to discuss what your goals and plans for the future are.
Well, I think, you know, it sounds like there's a lot more to talk about with palliative care too, and just that understanding. And I think, you know, one of our next shows too might be on palliative care, just to further going into that. And I want to thank you so much for being here with us today, you know, and providing such great information on hospice and palliative care and Care Dimensions. You know, we look forward to having you tune into our next show, which will talk about the Kaplan Family Hospice House. And during that show, we'll take you on a tour of the Kaplan Family Hospice House and answer questions about this amazing facility. I am Mary Crowe, and thank you for joining us, and we look forward to next time.